I don't get out of here that easy.
This is how 83-year-old Alvina Poole has been keeping herself busy and active for the past year, walking the halls of her apartment building. She loves socializing, but stays in because she knows she's vulnerable to COVID-19.
I don't go into restaurants. I miss all that stuff that I used to do.
She says getting vaccinated is the first step toward a return to normalcy.
Just looking forward to it, because I haven't been out of this apartment long time.
Today, she was among the first in line to be immunized in Nova Scotia's first community clinic. Welcome news for her son, who has been trying to balance taking his mom for walks with keeping her safely inside.
It's been a huge stress on me. For the last year, been a very huge stress. Now that she's getting this, it's a big relief.
Today's clinic is for people over 80 who don't live in long-term care homes, a prototype for which 500 people have been randomly selected by their postal codes. Researchers are here too, conducting interviews to determine what works and what doesn't.
So clinics could change, as we learned from this one, but the hope is that we will be moving everything that we've learned here to the rest of the clinics as they stand up across the province.
There are 48,000 Nova Scotians over the age of 80. They'll all be invited to attend clinics by next month.
I'm excited. Really. It was a Christmas gift that didn't have to be wrapped.
For this family, there is no vaccine hesitancy, only appreciation. But Poole says she would have given up her shot for someone else.
Because people are a lot worse off than I am. As you can see, I'm pretty fit.
She already has her appointment for her next dose. That will give both her and her family even more peace of mind.
I'm right behind you. Don't worry. I'm right behind you.
And so Kayla joins us now from the IWK Health Center in Halifax. Kayla, what is the next step?
Well, Adrienne, as we heard, Alvina Poole already has her appointment for that next dose. And Dr. Robert Chang, the province's chief medical officer of health, says he hopes all Nova Scotians over the age of 80 will have that second dose by early to mid-April. Then the province will start moving that age bracket down by 5 years at a time.
Okay, so the first vaccination clinics, it seems, are beginning in First Nations communities. What can you tell us about how that will work?
That's right. The first will be on the Millbrook First Nation. That's on Wednesday. And the province really is giving First Nations communities a lot of control over how they choose to administer this vaccine. They are doing things a little bit differently. So, for example, they are starting at age 55 and older instead of 80. And they say that's because they really want to focus on their elders and knowledge keepers to ensure that they protect their language and culture, Adrienne.
All right, Kayla, thanks for this.
You're welcome.
Okay, and also in Nova Scotia, the province's chief medical health officer, Dr. Robert Chang, good enough to make some time for us. Hello, doctor. Can you tell us, what is your initial sense or your intel from the ground on how today went, in the sense of what worked and maybe what didn't work?
Yeah, we checked in with the folks running the clinic at the IWK. They said that things went really well. We've got researchers who are, we're surveying all the people who came through, got immunized, getting their sense of even from the registration to parking to clinic flow, all those things. And we'll put all that together at the end of the 4 days of the clinic and help that to make the future clinics better.
Because are you already getting a sense of what the stumbling blocks might be? Because, other provinces are going to be watching how your province does as well. So maybe particularly for this age group, things that you think they ought to be mindful of or take into account?
So I think some of the biggest thing is identifying people. So we used our MSI, our health card database, identify everybody by age group. They got letters for this clinic of invitation. Future clinics, it won't be you won't need to be an invitation, but certainly a letter will go out telling people they can now register. They can have an online or a phone line option for this age group, especially. You can't rely on online. And even taking the details around parking, make sure we had extra accessible parking. People could park closely by the IWK. It's a busy hospital, but those things can make big differences about whether people are actually comfortable coming or not.
Okay, good to hear from you on this, Dr. Chang, on day one. Thanks so much.
Thank you very much. Have a good night.